Thank you.
While the last few people trickle in from the waiting room, I wanted to take a quick moment and I wanted to introduce Kelly Sheets. She is with the Department of Medicaid. She is going to be joining me in helping take care of all of our TACs and MACs. And then when I go on maternity leave in March, she will be your main contact until I return.
Thank you.
You're welcome. It looks like the waiting room is cleared. I counted all 5 members on today, so I will turn off my camera and turn it over to you guys.
Thank you. Glad to have everybody here today. We'll get started with introductions. I'll start. My name's Anlin Purdon. I'm the Executive Director of Hazelwood Home Health, and I'm also with the Kentucky Home Care Association.
Susan Stewart, CEO of Appalachia Regional Healthcare Home Services Division, also with the Kentucky Home Care Association.
Eldis Perez, Green River District Health Department. I'm with the Kentucky Home Care Association with the Kentucky Public Home Health Alliance.
Good morning. I am Marlene Reynolds. I am with the LHC Group. I'm the Regional Vice President of Operations for Central Kentucky and with the Kentucky Home Care Association as well.
Good morning, everyone. I'm Evan Reinhardt, Executive Director for the Kentucky Home Care Association.
I believe that's everybody on the committee that's on today.
Yes, ma'am.
All right.
Beverly Taylor. I'm with WellCare, Senior Provider Relations Rep, and I'm sitting in today for Stuart, Gina Pope, Lisa Lawson. They just asked me to fill in for them today because they all are away.
Thank you. All right. Approval of the minutes of the previous meeting. The only thing that I saw that I had a question on is on appearances, it has that Judy Broughton wasn't present. Somebody correct me if I'm wrong. She's no longer on the committee, right? She has to.
Yeah, Judy's not longer on the committee.
Okay. So I think we need to have her removed.
Yes, ma'am. I'll let the court reporter know.
Okay. And other than that, is there a motion?
I'll make that motion, Anlin. Susan Stewart.
I second that.
All in favor, say aye.
Aye.
All right. And I guess it gets us to old business. Evan, if you want to take over.
Sure. First item on home health reimbursement rates. I know this is something that the DMS was sort of taken in to consider, so didn't know if there's any update from Medicaid side on where things stand as far as reimbursement rates.
Hey, Evan, it's Pam. There's not any update on that right now.
All right, thanks, Pam.
Hi, I do, this is Leanna Trainer. I do want to make a clarification on that because we did make a change for EPSDT supplies only, and wipes and gloves have been added to the DME schedule for EPSDT benefits.
So yeah, and I am working on that, looking at that change order and answering some questions. But it did not change any of the rates from what I understand. It was just moving them to the DME fee schedule.
I have a question on the wipes and gloves. So those aren't billed with the EPSDT special services, right? We would bill those on a UB04 if they were approved.
You would either bill them, yeah, and use your 34 provider number, or if the DME provider was doing it, they would bill it on, I believe they bill on a CMS 1500, and they would use their 90 provider number.
Okay. Thank you.
Mhm. And we will have some education as we look into that change some more, there's going to be some either a recorded webinar or some written training and or explanations that come out on that to provide some further information.
Thank you.
You're welcome.
And then assuming there are no other supply reimbursement changes in terms of the policy to add supply only to the DME side, is there any further discussion that's happened on that?
So Evan, I am checking into as far as, because right now the change order that was written was only for the individuals that were under 21. So I am going back and looking at some documentation and evaluating whether or not that change would be across the board. So I will, by next meeting, hopefully have some better updates that I can give. I'm just trying to go back and kind of look at the history of what happened and look at the change orders that's been implemented and see where we want to go from there. So by next meeting, if not before, I should have a better update for you.
Okay, thank you. And then
Mhm.
likewise, the last piece is the supplies limits being published for MCOs and then standardizing. I think there was some correspondence happening between the MCOs and DMS. Is there any progress been made on where that stands, or?
I'm looking, Erin, is Malia or Edith on?
This is Angie Parker. I'm sorry, I started my video instead of hit my mute button. I don't think we were going to publicize the supply limits for MCOs. We were just provided those. We got that information from the MCOs with the exception of one and provided that to the TAC, if I remember correctly.
Yeah, I don't think we've seen that information yet. So it'd be great if we could get a hold of
Andy,
it.
I don't think that was sent out yet due to the holdup from the one MCO and
Oh,
then,
okay.
the information they sent from CMS regarding sharing that information. So
Okay.
we can follow up, and if that is okay to send, I still have that information. And I'm happy to send it out.
Okay. Thank you, Erin.
So Angie, you mentioned, that you all weren't going to publish it, but you're going to share it with the TAC with, I'm assuming, the intention of us sharing it with the providers out there. Is that correct?
Yes, that is correct.
Okay, gotcha. And then any discussion on standardizing those supplies limits? Just,
Not at this time.
okay. All right, anybody have anything else from the rest of the TAC members?
I don't.
So I think, good first step for us to get this information and have it in our hands. That'd be ideal. But, I think we're definitely going to continue to strongly recommend that it be standardized at some point. So, but yeah, we're looking forward to seeing the information as soon as we can get it.
I apologize for the delay. That's on me, not Erin.
Well, thank you.
We appreciate all you do, Angie.
Well, I try. Thank you.
Evan, you're doing such a great job. You just want to flow right into new business?
All right, I'll keep going here. Any update from DMS on the EVV delay request? I think, some states are sort of in progress with that. So just seeing where it stands.
We have submitted the good faith extension, the GFE. We've submitted that to CMS now for the home health services portion of EVV. So
Okay,
we are awaiting a response, but it has officially been submitted.
great. All right. Thank you for that information.
Mhm.
And then we have updates from all DMS department directors. So I don't know how many are on the line and what kind of updates they might have, but open the floor up for anybody who has anything to share.
Well, I mean, I have one thing to share, and I don't know how relevant this is, but Leanna Trainer is the Assistant Director of Quality and Population Health, effective October 16th. So that would be in my, you may be seeing her name and helping me out with some things as well. She also spoke earlier. The quality strategy is out for public comment until October 25th, I believe, 6th. I think Aaron sent that out to all the TAC members. If you haven't had a chance to review it, I would recommend you to do so.
Yeah, and we've got a draft together of comments, Angie. So we'll definitely be submitting those ahead of the deadline at the end of this month.
You got 1 week. And so everybody's going, I haven't got anything yet. So everybody's going to inundate me all at once. And
Well, if we'll get everybody to sign off and I'll get it to you ASAP so we can be number one.
okay. There is the email address that you can send it to.
Yep, I saw
Or
that.
you can always send it to me too, but if you want to CC me, but that's fine.
Okay. Yep. I'll use the email address.
And that's the only update I have.
Yeah, I don't think, Evan, I don't have anything as far as long-term services and supports other than what we've already talked about.
All right. Anything else on the DMS side? And then the next item for us. Go
But
ahead.
I have a question.
Yep.
Could we get a list of all the department heads of each, updated list? Because I'm not sure I know who's over what anymore.
Yes, ma'am. I'll work on that and get it over to you guys.
Thank you.
Yeah, that would be helpful. Thank you. Anything else? Is that it? Everything for DMS? And then we have data and info from KHCA. I think this is just our general, if there's information from industry, from the agency, the, members of the organizations out there providing the care that we can provide to that would be helpful. We're happy to do that. And I don't know if there's any more detail you want to add to that in terms of the bullet talking point, but just throwing that out there for DMS to respond to.
Yeah, I think the discussion was just if there's anything that DMS was wanting from us or needing from us or would like to see, we would just like to hear it.
This is Erin. I will mention, Evan, that Pam and I received your data request and we're working on getting that information together for you and back out to the TAC.
Great. Thank you. That was the one on your referring to the one about reimbursement rates. Is that?
I believe so. You submitted
Okay.
it to us right after the last meeting, and sometimes data requests can take about 60 to 90 days to get together and reviewed. So hopefully we'll have that all gathered and out to you soon.
Okay, thank you. All right, hearing nothing else, do we want to jump down to general discussion?
I think so.
Any updates from our MCO partners, common billing issues, PA issues, any other home health specific issues that you all have noticed on your end?
Good morning.
Evan, sorry, go ahead.
Go ahead.
Evan, it's Chris Kern with United. I'd volunteer to go first.
Sure, thanks, Chris.
Yep. So a quick prior authorization update. We have noticed that there has been some issues with providers submitting clinical documentation via our online provider portal or via the fax in a timely manner. Just want to make you aware that we would like to have that clinical documentation submitted with the PA request or within 2 business days. If we don't get that information within 2 business days, then we must put the request in a pending status until we receive the clinical information from the provider. So if you just share that internally. We also have noticed that some PA requests are being requested as expedited. In fact, it actually occurs quite frequently. Most of the requests do not meet the definition of requiring expedited processing. So if a provider submits requests and the appropriate clinical documentation, we will be able to make that medical necessity determination within 2 business days on a routine PA request. Also want to reiterate that we are still continuing to want to contract Kentucky home health providers. You can request an application for participation with our network through our uhcprovider.com portal. Select the join our network icon, and then we can work with you to get contracted into the network. So just want to put a plug in for that. Also on claims, and this would be for dates of service July 1st, 2022 to September 30th, 2022. I have a top 5 denial reason. YY1 edit is billing MPI not enrolled or active. ST edit is a member termination, so member's not eligible. A27 is the 3rd top reason. Send primary carriers EOB. So if a member has another insurance, please make sure you're sending that to us. E80, resubmit on correct claim form. We do have some billing on an incorrect claim form, so just want to reiterate to submit on the appropriate claim form. And then the other one is typically what you would see, which is an agreement discount from what your billed amount is. So that rounds out the top 5. Those are the conclusion of my comments. Love to entertain any questions anybody have.
Thanks for that.
Evan, back to you.
Chris. Yeah. Any questions from other members of the TAC?
Thank you for the tax time today, Evan.
Appreciate it. All right. I think Beverly, you were up next.
Yes, I'll go ahead and share the information that Stuart shared with me. Let me share my screen real quickly. If we can do that. Can the host give me permission?
I just did. You should be a co-host now.
Okay. Let me know if you can see my screen. Not yet?
Not just yet.
Okay, well, I can give you the information. It's a pretty graph, but I can give you the information. Looks like he pulled 2021 data on claims, and WellCare had 32,198 claims that paid, 9,242 that denied. Not a bad ratio, 22% denied of the total. Looks like 41, a little over 41,000 claims. Of those, he pulled the top 10 claim denial reasons, and I won't go through all of those, but by and large, the overwhelming largest reason is prior authorization required but not obtained. And I'm not sure that's a surprise, because I think that tends to be across the board with a lot of provider types. But that was the main reason, with just over 2,000 claims denials being for that reason. The next one was just a little over 1,000. The next highest reason, and it was denial with no patient responsibility. And then about running at about the same rate were denials for duplicate services billed, so billing errors there. Following that, it's exact duplicates of claims, again, billing errors. I'm not sure any of that is a surprise, but Stuart wanted me to share that information with you.
All right, thank you. Any questions from anybody on that?
I don't have a question, Evan, but I know we've got a couple more to hear from, but I was wondering if we could get a one pager from all the MCOs on what they're sharing with us. It's hard to get it all written down.
Yes, I can definitely send that. Just let me know where to send it to since I'm new to this.
I would
would,
second
yeah,
Beverly's comments. Be happy to send.
You guys can send that to me and I'll drop my email in the chat and I'm happy to forward it to the TAC.
Perfect.
Okay, thank you.
Thank you. All right. Anyone from Humana? Just going down the list.
Yes, good morning. This is April Evans and I'm with Humana Healthy Horizon, and I do have an update and a reminder. The first update that I have is in regards to our grievance and appeal timeframe. That will be changing effective 11/1/22. That will be, we will be implementing a new policy for filing provider grievance and appeals, like I said, effective 11/1/22. The providers will have 60 days from the date of notice, action, date of original claim submission, denial, to file that grievance and appeals. That is, of course, you can submit those grievance and appeals through mail, fax, call provider services, or Availity as well. We also have a reminder that EvCore went live on 9/1/22 for all of our therapy services. So you do have the prior authorization list that we have, and that we have a website that you can go to on that. And that is Humana. Let me get that so I don't tell you wrong. Humana.com/PAL. You can go to that to validate that the code is on our prior authorization list first before submitting for an authorization. And that's just a friendly reminder.
Thank you. And is that something you can share on a kind of one page or two with that information?
Absolutely, yes.
Perfect. Thank you.
Thank you.
All right. Anyone from Molina?
Hi, good morning. This is Anna Page. I'm the director for the Utilization Management Program. I have not heard of any type of PA issues with the home health providers. Most of our requests are received via fax, and we're pretty good with working with the home health providers on getting the clinical information needed to complete the request. I do have some information from the last meeting I can share with you, and we'll also include that in the one pager. So the claims department did pull some data from all of 2021 and the first 6 months of 2022 on rejected claims. Of the close to 16,000 claims, 0.06 were rejected. So very, very small amount of rejections. And the top reason for the rejection was the member could not be located in the plan database. To date, there have been 0 audited home health providers, and I will include that information in the one pager. No issues noted from our end.
All right. Thank you.
You're welcome.
And Aetna, anyone from Aetna? All right, hearing none. I don't know if Anthem's on.
Can you all hear me? This
Hi.
is Crystal with Aetna Better Health.
Yes, we can now. Yes.
I was double muted. At this time, we actually do not have any issues that we have noticed that would be what we would consider global to affect providers across the board. What we do see is kind of just your one-off. It'd be authorization, COB issues, member eligibility, just, the normal denials that is common. And as far as any kind of updates system-wide, I think everything goes out in our fax blast. There's not been any kind of new notices sent out within the last 2 months. So everything looks good. But now if you all have anything that you see come up, please feel free to reach out to us and let us look into that.
All right. Does that take care of our MCO updates? And I think we sort of touched on DMS updates earlier, so don't know if there's anything further from DMS or Commissioner Lee.
I believe the commissioner had a meeting with the secretary of the cabinet and was unable to make it today.
All right. Otherwise, I'll turn it back over to you, Anlin, for recommendations and then closing things out.
Do we have any recommendations? I don't think so at this
Yep.
time.
Doesn't look
think
like it
so.
for today.
Okay. We will, I'm assuming Susan will be at the next MAC meeting. So we'll have a representative there.
Yes.
Alrighty. And our next meeting will be December 20th.
That's correct.
Motion to adjourn.
I'll move to adjourn the TAC meeting.
Second.
Second.
All in favor?
Hi.
Aye.
Thank you, everybody, for your time today.
Thanks, everyone.
you.
Have a
Appreciate
good
it.
one.
Thank
a good
you.
day.
Great afternoon.